Anxiety is a normal and often healthy emotion. It's a feeling of worry, nervousness, or unease that can arise in response to perceived danger or threat. Anxiety can cause physical symptoms such as a racing heart, sweating, trembling, and shortness of breath. It can also cause mental symptoms such as difficulty concentrating, fear of the unknown, and negative thoughts. While anxiety can be a normal emotion, it can also become a problem if it is severe or persistent. Anxiety disorders are the most common mental health conditions in the United States, affecting over 40 million adults each year. There are many different types of anxiety disorders, including generalized anxiety disorder, social anxiety disorder, panic disorder, and obsessive-compulsive disorder, OCD. Symptoms of anxiety. The symptoms of anxiety can vary from person to person and can depend on the type of anxiety disorder that you have. However, some common symptoms of anxiety include 1. Physical symptoms. Racing heart, sweating, trembling, shortness of breath, dizziness, nausea, muscle tension, fatigue. 2. Mental symptoms. Difficulty concentrating, restlessness, irritability, worry, fear, negative thoughts. Causes of anxiety. The exact causes of anxiety are unknown, but it is thought to be caused by a combination of genetic and environmental factors. People with a family history of anxiety disorders are more likely to develop anxiety themselves. Additionally, certain life experiences, such as trauma, stress, and abuse, can increase the risk of developing anxiety. How to deal with anxiety. There are many effective ways to deal with anxiety. Some self-help strategies that can be helpful include 1. Exercise regularly. Exercise is a great way to reduce stress and improve your mood. Aim for at least 30 minutes of moderate intensity exercise most days of the week. 2. Get enough sleep. When you're well rested, you're better able to cope with stress and anxiety. Aim for 7 to 8 hours of sleep per night. 3. Eat a healthy diet. Eating a healthy diet can help improve your overall mood and well-being. Avoid processed foods, sugary drinks, and caffeine, as these can worsen anxiety symptoms. 4. Practice relaxation techniques. Relaxation techniques such as deep breathing, meditation, and yoga can help to calm the mind and body and reduce anxiety symptoms. 5. Avoid alcohol and drugs. Alcohol and drugs can worsen anxiety symptoms. If you're struggling with anxiety, it's best to avoid these substances altogether. If self-help strategies are not enough to manage your anxiety, you may need to seek professional help. A therapist can teach you coping skills and strategies to manage your anxiety. They may also recommend medication if necessary. Types of therapy for anxiety. There are many different types of therapy that can be effective for anxiety disorders. Some of the most common types of therapy for anxiety include 1. Cognitive behavioral therapy, CBT. CBT is a type of therapy that focuses on helping you to identify and change the negative thoughts and behaviors that contribute to your anxiety. Exposure therapy. Exposure therapy is a type of therapy that involves gradually exposing you to the things that you're afraid of in a safe and controlled environment. This can help you to learn to manage your anxiety and fear in a healthy way. 2. Acceptance and commitment therapy, ACT. ACT is a type of therapy that focuses on helping you to accept your anxiety and live a meaningful life despite it. Medication for anxiety. There are a number of different medications that can be used to treat anxiety disorders. These medications can be helpful in reducing anxiety symptoms and improving quality of life. However, it's important to note that medication is not a cure for anxiety disorders. It's important to use medication in conjunction with therapy to get the best results. If you think you may have an anxiety disorder, it's important to talk to your doctor or a mental health professional. They can help you to get a diagnosis and develop a treatment plan that is right for you. Here are some additional tips for dealing with anxiety. 1. Talk to someone you trust. Talking to a friend, family member, therapist, or other trusted person can help you to feel better and get support. 2. Learn about anxiety. The more you know about anxiety, the better equipped you will be to cope with it. There are many resources available online and in libraries. 3. Take breaks when you need them. If you're feeling overwhelmed, take a few minutes to relax and clear your head. Go for a walk, listen to music, or do some deep breathing exercises. 4. Be patient with yourself. It takes time to learn how to manage anxiety. Don't get discouraged if you don't see results immediately. Just keep practicing the coping skills that you're learning, and eventually you will see improvement. Remember, you are not alone.